All right, right this way.
I'm here to get injections,
Lift your feet for me just a touch.
which will hopefully loosen it up
How's that?
and get some of the inflammation down so I can actually, walk and sit down and stand up in comfort.
Be careful, don't lift up.
Everything Diane Langdon has tried until now hasn't worked. But that's why she came for an injection. Diane's fear beforehand?
Injections in your back, needles aren't exactly the funnest, but I'm very confident that it will go well.
Dr. Stephen Polai is going to give her a steroid injection right where it hurts.
I'm hoping the after that I feel like $1 million.
Dr. Stephen Polai says approximately 35% of patients have back pain that comes from joints. 15% have back pain that comes from the disc, and 50% have back pain that comes from muscles or nerves. For Diane, it's a joint problem.
We treat that often by putting a needle in the joint and putting steroid and numbing medicine inside the deranged joint. So we may do more than one injection before we find the correct one. Most common questions are, what are the risks, of course, and what are the benefits? Those are the most common questions. And the next one is, what can or can't I do afterwards?
There are some risks with a back injection. 1 in 1,000 patients experience bleeding or infection. 1 in 30,000 patients have a mild allergic reaction to the contrast injected during the procedure, while 1 in 300,000 patients have a severe contrast allergy. The benefit is that the steroid can take away the irritation and inflammation that's causing you pain.
Yeah, needles out, we're all done.
Afterwards, you can't take a bath or go swimming that day. That's the only restriction.
The steroid medicines may make them better for weeks or months or sometimes years. And then they can go about their daily activities and not have pain.
That's going on.
Yep. I would say I am feeling better already, and I'm completely shocked and blown away that it was that great.
How's your back feel?
For Diane, back pain relief came instantly.
I was kind of nervous going in, thinking that it was going to be terrible and it's going to be huge needles, but Dr. Polai did an amazing job. I've been in pain since September, and actually today, after this experience, I feel better than I have in a long time. So I would at least give it a try and see if it works for you.